This video has shocking sexual content. Be advised. I want to talk about ED. It's not the ED that you're thinking about, erectile dysfunction, but it's called epithelial dysfunction. In fact, everybody who has erectile dysfunction also has epithelial dysfunction. That means that there's damage to the arteries, the lining of the arteries, that lead to plaque buildup and a lack of blood flow. One of the main problems with erectile dysfunction. The cholesterol theory of heart disease has been mostly debunked. In fact, one of the reasons that the arteries plaque up is that there's damage or epithelial dysfunction to the lining. Once the lining gets damaged, cholesterol pierces it, goes underneath the lining into the muscle cells. The muscle cells and the white blood cells attack it, you get a big foam cell, and it pushes up in the artery, causing plaque. So it's not the cholesterol, it's the inflammatory byproducts. Cholesterol-lowering drugs, but there are severe side effects. One of them being loss of libido, erectile dysfunction. In fact, people who take cholesterol-lowering drugs have a 40% higher chance of fibromyalgia. It also causes muscle fatigue and severe memory loss in patients. One researcher found that a person who was a translator took a statin once and had a complete memory loss. In fact, there's a book called Thief of Memory that outlines all the different side effects of statin drugs. While statin drugs do lower some inflammation, they have these severe side effects. Another of the side effects that cause erectile dysfunction is because statins block cholesterol. Cholesterol produces every hormone in the body: DHEA, pregnenolone, testosterone, progesterone, estrogen. So when you block that, you have a loss of those hormones and dysfunctions. In fact, to get those hormones back to a normal level, you at least have to take 1,000 milligrams of C a day, 50 milligrams of zinc, and you also have to take at least 2,500 IUs of vitamin D to restore that. Another very important thing for erectile dysfunction is arginine. Arginine will not only increase function, it will repair damage to the artery linings, epithelial dysfunction. It will lower your blood pressure, and it will reduce the incidence of heart attack. You know, at the end of this, I'm going to give an opportunity to get a copy of my book, Your Heart May Be a Ticking Time Bomb, where I go over all the research on cholesterol and all the nutrients needed to replace what's lost by cholesterol and all the other nutrients that reduce your risk of heart disease. Plus, I also give you an opportunity to get a free bottle of amazing supplement that has over 33 all-natural nutrients to improve heart health, including C, zinc, vitamin D and the proper levels, plus arginine and a host of other nutrients, all for maximum